Today we will be discussing the causes of the blue baby syndrome and how to treat it. A study conducted at Howard Hughes Medical Institute suggested that one of the likely factors for the blue baby syndrome can be found in the parents. A gene known as RAF1 codes for a signal transduction pathway to the nucleus of the cell, resulting in proliferation of cells and allowing this gene to control the growth and movement of cells, as well as survival or apoptosis. A change in the amount of RAF1 could potentially cause the blue baby syndrome. The more widely believed cause is the growing issue of nitrate contamination from the use of water wells, in which the pregnant mother consumes. The water then travels to the placenta, an organ that provides oxygen to the fetus as well as nourishment. This water is a large risk for methemoglobinemia, a blood disorder with an abnormally large amount of methemoglobin. Oxyhemoglobin is a protein that carries oxygen through the blood. However, as the nitrate reacts with oxyhemoglobin, methemoglobin, a type of hemoglobin, is formed as a result of this reaction. Since methemoglobin is unable to carry oxygen, this leads to decreased levels of oxygen in the blood and results in the fetus having the blue baby syndrome. A tetralogy of Fallot, a form of blue baby, is a result of 4 defects of the heart. A ventricle septal defect is the hole in the heart between the right and left ventricles. If the hole is large enough, it will cause heavy breathing, as the lungs must work harder in order to properly oxygenate blood. An overriding aorta is an aorta that has become enlarged, allowing more of the mixed oxygenated and deoxygenated blood to flow around the body. Pulmonary stenosis is a defect in which, at points in the right ventricle, there is a narrowing, causing an obstruction or blockage of proper blood flow through the pulmonary artery. Right ventricle hypertrophy is a result of when the right ventricle muscle wall thickens more than the other, causing the heart to have to work harder to pump blood throughout the body and can result to heart failure. But what exactly is the blue baby syndrome? It is a congenital pulmonary or cardiac defect of the heart, which is a heart murmur. This syndrome is caused by a hole in the heart that is located between the right and left atrium. This causes the oxygenated and deoxygenated blood to mix, essentially leading to the baby turning blue. Some symptoms that the baby may have tetralogy of Fallot includes gasping, breathlessness, weariness, fatigue, sluggishness, impaired development, and the more obvious symptoms would be the heart murmur and the blue-grayish tint in the baby's skin tone. Some tests and procedures used to diagnose tetralogy of Fallot includes an echocardiography. It utilizes high-pitched sound waves to create a motion image of the heart. An electrocardiogram measures the heartbeat. It allows the doctors to determine if there is right ventricle hypertrophy. A chest X-ray allows for signs of heart failure to be seen. These signs would include the enlargement of the heart and an excessive amount of blood present in lungs. A pulse oximetry is a sensor that determines oxygen levels within the blood, and a cardiac catheterization is a thin tube inserted from a vein to the heart with a dye to determine blood flow, blood pressure, and oxygen levels. If a baby presents these symptoms and is believed that the baby may have blue baby syndrome, then a blood test is run to determine the amount of oxygen present. If it is determined that the cause of the blue baby syndrome is nitrogen contamination, then the treatment is simply a variety of medications. If the syndrome is caused by tetralogy of Fallot, then a more serious approach of open heart surgery is required. There are 2 types of surgeries. One would be a temporary surgery called palliative if the baby is still too weak. It allows them to get strong by the improvement of blood flow to the lungs, increasing oxygen levels enough to undergo the full surgery. A shunt between the pulmonary artery and a large branch of the aorta is placed as an extra pathway of blood to the lungs. Medications till the complete repair may be needed in order to allow the shunt to remain open. The complete intercardiac repair resolves all the defects by the enlarging of the pulmonary valve and vessels along with the passage from the right ventricle to the pulmonary artery. The ventricular septal defect is resolved with a patch covering the hole, and the other defects resolve as a result. TET spells can be a result of a tetralogy of the heart that has not been treated. If one occurs, try to calm your child and pull their knees tightly against their chest. This will allow more blood flow to the lungs. Ongoing medical care will be needed, and restrictions of sports and exercises will be set by the doctor. The baby will need extra nutrition, supplements could be helpful, and feed your child small amounts at a more frequent rate.